Now, the reason that New Zealand's here this year is because we feel that we have some good offerings in terms of healthcare services that will really have some positive outcomes for the Indian community. Now, New Zealand, while it's a small country, has largely a public health system, and that's quite efficient and quite cost effective. So a number of New Zealand companies develop their products and services with the New Zealand system, and then they have a wider offering to the international community. So a number of the companies that we have on the stand have come up that way. And a lot of the companies that we have in New Zealand are small to medium scale companies, and I would describe many of them as big fish in small ponds. So in other words, they are very niche suppliers or a niche market, but they are maybe the 1, 2 or 3 biggest supplier in the world. And a great example of that is Fisher & Paykel Healthcare, who are with us today on the stand. They specialise in sleep apnea products. Sleep apnea is an issue that is often associated with diabetes, where people don't sleep particularly well, and they have products that help keep the airways open and give them a good night's sleep, so they're more productive and their health is better as a result. They've also been very innovative in developing a new product for laparoscopic surgery, which uses humidified air to keep organs moist during the surgery, and therefore much better recovery and better outcomes from the surgery as a result. Now, I've got another company called Pictor. They have a 5-in-1 test. Now, for pregnant women, there are about 5 tests that are normally done to ensure that the baby will be healthy when it's born. Now, I understand in India, not all of the women can afford those tests, so they maybe have one test, and as a result, there are babies that die fairly soon after birth because some of the diseases haven't been picked up. So these diseases, the 5 are, there's toxoplasma, there's rubella, there's herpes simplex 1 and 2, and a few others. So it's called the torch test, and so they offer one test in a laboratory and it covers all 5. So it's a lot lower cost, and it's going to save lives of babies in India. And at a different stage of life, people sometimes have strokes, and there's a company that we've got on the stand called I'm Able that has an ear mouse, and so it deals with limbs that may have been disabled as a result of a stroke, and a computer program so they can work out on the computer and get that brain limb functions going again, so better recovery from strokes. Another company in the health space is a company called Izon, which is into nanotechnology. So they have a real-time measurement of nanoparticles. And so the Indian Institute of Technology in Mumbai is doing quite a lot of work around cures for cancer or treatments for cancer. And they're looking at delivery of drugs directly into a tumour using nanotechnology. So this machine is a key part of that. We also have in the training area on the stand 2 companies. One's called Simtix, which offers simulated healthcare solutions online as training, and they have a MOU with Medvarsity, so Apollo Medvarsity here in Hyderabad. And the other company is Unitech. Now, Unitech is our biggest provider of vocational and training services, and it is a company that is able to. Can we just cut that? Sorry, have you got a problem or? Yeah.
You can continue.
Okay, so. The other company is Unitech, and it's our biggest provider of vocational and training services in New Zealand. So that's both healthcare and IT. And they've been speaking at the conference here, and they're looking at getting students ready for employers. So as soon as they leave, they're ready for employment instead of having to be retrained or further trained. And they've started some courses in India to do exactly that, and looking at more courses shortly. On the general business side, we have a few companies. One is Pingar, and Pingar has a product that searches big data. So what's happening in the healthcare industry in India is a lot of physical records are being digitized, and so there's a lot of information in those records which can be used, looking at how treatments have been done, what works, what doesn't, across a whole range of patients. Now, Pingar's system is able to search huge amounts of data in a few seconds and put it into a report with headings, and that will be very helpful to the likes of Apollo Hospitals and others. The other company that we have in that space is a company called Serco. Now, Serco offers a travel solution for corporates, so they can have their corporate travel policy and book travel. Now, that applies to large healthcare companies as well, and it means that they can reduce their costs of travel by getting the best fares and complying with their corporate travel policy. And as a result, for the healthcare industry, it means there is more money to be put into the front line. So with combination of all of those companies, and we hope in future years to bring other New Zealand companies into the market that will offer further healthcare solutions for the wider Indian community. And we look forward to coming back next year. There have been a number of collaborations that have been done. I've just mentioned some of them, and some of those companies are based here and have been here for quite some time, like Fisher & Paykel, for example, have a sizable office in Bangalore, as do Pingar. So there's already quite a commitment from New Zealand companies, but there are others that are quite innovative and will have other solutions in the future. The benefits of participating in a fair like this is you meet a lot of people and you understand who fits in where into the health system. So knowing that's helpful for when New Zealand companies are looking for partners or people to work with in the market. So this conference is very helpful from that perspective in connecting people together. I think the conferences have been fantastic. They're very visionary. We heard yesterday from Vinod Khoshla, who has some quite forward-looking ideas on how the healthcare system is going to be in 10 or 15 years' time. And we also heard from the former director of the NHS from UK talking at similar things, that it's patients that will be looking after themselves to some extent, and then the professionals will come in where needed. So it'll mean a lot more self-service in healthcare. And I think a number of the New Zealand companies will very much fit into that kind of system for the future. Thank you very much.